everyone. We're so pleased that you've joined us today to learn about the McMaster Optimal Aging Portal. This is a project that several groups have been working very hard at for 2 years now, and we officially launched the portal back on October 1st, 2014. And we're now really trying to make sure that everyone who should know about the portal is aware of it, knows how to use it, and is able to promote this to their clients and patients, family members, other networks for which this information may be very useful. You don't need a microphone to participate in the webinar today. If you would like to contribute to discussion and questions following my presentation of the portal, then we would really like you to use to the chat function below to all attendees. That way everybody will be able to see those questions, and then I will do my best to answer those questions as we go. If you are experiencing any technical difficulties, the best option is really to contact WebEx on their helpline, and the number has been included below in the chat function, but the number is 1-866-229-3239. And just one final check in terms of checking your own audio. You go to communicate speaker/microphone audio test to test that your own speakers for your computer are working. So I'm just going to start, and we're actually starting with a polling question that we would like you to answer. And just the question we're interested in knowing today is, how often do your older clients, so those aged 50 plus, use the internet to get health information? So you'll see here that there are 4 options: every day, once per week or more, once per month or more, or less than once per month. So if you could just let us know your perception of how often they're using the internet in this way. And I'm just going to give you a moment to answer that. And then we're going to move on. Okay, so we're just going to move on. I'm just checking to see. So we're just ending the poll now, and so we're going to move on now. So the McMaster Optimal Aging Portal has been brought together to really make it easier for citizens and caregivers and other health professionals to easily find the kind of information that folks are looking for to either age optimally or to live as well as they can with any diagnoses they may have. So it's putting into one place the best available evidence that has been appraised for quality and making that easily searchable. It's putting it into layman's terms, so the writing of short summaries of what that information means. And other components of the portal are really to, because we know there is so much information available on the internet, we want to assess that and provide that information for citizens so they can have a sense of what type of information is trustworthy that perhaps they could then discuss further with their healthcare professionals and caregivers, and what information maybe has a few red flags that they might want to steer clear of. So who is the portal for? There's actually, and if I just give you a little bit of feedback on the poll that we did, the majority of you said that your perception is that your clients 50 plus are accessing the internet once per week or more. The majority said that, followed by once a month or less than once a month. So who is the portal really for? Well, the portal is for many people, as I was indicating. The portal can be for Linda, who's depicted here, who is someone who is really interested in wellness. She wants to exercise. She believes that vitamins are an important part of optimal aging, and she wants to know what to avoid. But there's so much information out there. Where can she go to easily get this information and know that she can trust it? The portal is also for Janine, who is a caregiver, who is interested in how to prevent falls in her clients. Wanting to know if there has been a fall, what the prognosis would be. And for returning home, this could actually be for a family member as well, a family caregiver that may be looking after a parent after a fall and wants to know what sort of things will we need to be aware of upon returning home, and what types of activities can really help recovery and prevent further falls. And the portal is also for healthcare professionals who need access very quickly to good, reliable information and the best evidence that is out there. So the portal is really for a variety of people, and we've created the portal in such a way that no matter if you are a citizen looking out for information for yourself, or an informal caregiver, or a health professional, there are ways to easily find that information that is most relevant for you. So I understand that there are some technical difficulties. So I'm just going to hold here for a moment. Hello, everyone. I'm just doing a check that you are able to hear me now. I disconnected and called back in, so I'm just waiting for confirmation that you are now able to hear me. So just bear with me for a moment. So thank you very much. I'm sorry about the delay there, and I understand that you are able to hear me now, so I'm going to move on. So we've talked about who the portal is for, and now I just want to tell you a little bit about what is on the portal. I started talking about that briefly, but there's many components to the McMaster Optimal Aging Portal. And we start by bringing together 3 world-class evidence repositories, and I'll talk about those in a moment. Those all 3 which exist at McMaster University that are focused on evidence related to my health, so what individuals need and clinicians need to help their clients, evidence on our health, which is really the public health literature, and then evidence on health systems, which helps us understand how to optimize the healthcare system. And all of those have been brought together under one platform with the McMaster Optimal Aging Portal. And from that, we have further identified the most relevant evidence for optimal aging that is of the highest quality, and then we write short evidence summaries from synthesized evidence, so systematic reviews. That's one of the evidence sources. And as I said, we're also searching the world on the internet for information products that are available about anything related to optimal aging. And we've developed a way to really assess the quality of that information, and we provide a rating for that information on the site. We also are writing blogs, so blog posts on priority topics that are being written by a professional writer in very layman's terms that really put into, really talk about what really is the bottom line of this evidence. And then some of the functions of the McMaster Optimal Aging Portal is that you can decide what kind of information you would like pushed out to you on a daily or weekly basis by identifying particular topics that you're interested in receiving information, and those are the email alerts. And then you can come onto the site, of course, and you can search for specific items, or you can also browse according to many topics, and that's what I will go through today. So as I was just describing there, the three evidence databases, repositories that are contributing to the portal is MAC Health, which is for My Health, Health Evidence, which is for the Our Health, public health literature, and then Health Systems Evidence. So these are the three databases. And then this has all been, I meant McMaster Plus is My Health, and then MAC Health is what has been helping develop the functionality and that interactivity of the site to make this a site that's really helpful and useful for citizens. So in terms of the team, these are the leads of all of the teams that are involved in this project from left to right. Dr. Anthony Levinson, Dr. John Lavis, myself, Maureen Dobbins, Dr. Parminder Raina, and Dr. Brian Haynes. But of course, we really are just the leads, and we all have a staff of very dedicated team members that are the ones that have really resulted in all of the work and the content that has gone into the portal thus far. So this afternoon, I want to really talk about what the different content is on the site, and then we're going to finish off by me illustrating to you some searches on the site on different types of topics and what type of information you would get if you were to conduct those searches on the site. So as I was briefly mentioning, the evidence summaries are key messages that arise from high-quality synthesized evidence, systematic reviews that exist in the three databases, and that is really current. So we are really focusing on the newly emerging synthesized evidence coming out each year. And we write those in plain language, so really removing the research jargon that we get with research publications and putting those into plain language and trying to keep them fairly short. They're a useful source because they do remove that research jargon so that they're easier to use, easier to understand, and we're really focusing on those that have actionable messages. So something that would say, give you some clear direction on things that you could be doing around optimal aging. And this is just an example of what an evidence summary would look like. If you've done a search and you clicked on, I would like to see an evidence summary, this is what you'll get when it pops up. So we, first off, if it's your first time you're using the site, we'll tell you what an evidence summary is. But once you know what they are, you don't need to see that box all the time. So you can click on the box there that says got it, hide this, so that you don't need to keep being reminded of what an evidence summary is. This particular evidence summary is around, is on blood pressure and lowering drugs and what impact that has on cardiovascular events, for example, heart attacks, and people that are, have an initial high risk for heart attacks. So what you see is a star system. You will see that this has 4 burgundy stars and 1 gray star. So in terms of quality, so how well done was the review that this evidence summary is based upon, you will see that this has been rated a 4 out of 5, which means that it is a very well done review. You see the citation there so that if you were using that, needed to use this citation, you know where this review came from. And then we start with the review question. So what was this review about? What were they answering? A little bit about the background of what the issue is that's being studied. You can see here in near the lower part of your screen a box that's jumped out that says studies where people are assigned to one of the treatments purely by chance. So it's difficult to remove all of the jargon. So where we still have words like, in this case, randomized control trial, you can hover over that word and then you will get a definition of what a randomized control trial means. So this is the standard format for all of the summaries, and when I move on to what you would see on the lower half, the lower portion of this evidence summary online, you can see what the researchers found in terms of the results. In this case, reduced major cardiovascular events regardless of the initial risk level, and also that the blood pressure lowering drugs had the greatest effect in people with the highest initial risk. So we see our findings there in words, and then sometimes where the data exists, we will also provide a table for you. Some people like seeing numbers and tables, and we've provided also a table that puts the results into numerical form for those that are interested in seeing that. So that's what the evidence summaries look like. So now we move on to web resource ratings. So as I said, these are evaluations of health resources, knowledge products that exist on the internet. Of course, anyone can put anything onto the internet, and we know that it's really difficult to know when you should trust something and when you shouldn't, or when you should be perhaps questioning it more. And so that's what we're trying to make that easier, to work your way through all of that information, and for the citizens for which the portal, this portion of the portal is really directed towards. So it helps you know which resources are based on scientific evidence, is really the basic activity that we're trying to make you aware of here. So if you had come onto the site and had done, and you were interested in understanding more about the web resource ratings, if you had clicked under the Citizen tab at the top, then you can find out what the web resource ratings are. That's actually a little bit hard to say quickly. It's telling you what they are, and then you can read some more information about recently rated web resources. So we're constantly adding new resources to the portal every day, every week, every month, and this gives you a short list of new ones that are on there. So in terms of what we're assessing, there's really multiple processes that are embedded within the web resource rating activity. So first, we search the world for websites, and we're assessing those websites to be relevant to optimal aging and some other criteria I'll go over in a moment. Once we have determined that a website will be included in the portal, then we determine whether or not which resources on that website are going to be included in the portal. And then once we've decided which resources will be included from that site on the portal, then we assess the quality of that web resource. So a little bit more about how we assess that. So our inclusion criteria, both at the website level, is that the website cannot be directly funded by a company that is trying to sell you a product or a service. It has to be relevant to optimal aging. There has to be at least some content that is intended for citizens, and it has to be freely accessible. So there can't be a cost to signing up for the site. So once we've decided that a website meets all those criterion, then we start looking at all of the resources that they have, and we ask similar questions in terms of, it's not directly funded by a company trying to sell a product or service. That particular resource needs to be relevant to optimal aging. It needs to be intended for citizens, and it needs to be less than 5 years of age. And then we move on to assessing the quality of that resource. So once we've decided that that web resource will be included in the portal, it is then rated for quality by 2 independent raters. So that means 2 people on their own both look at that resource. They follow a procedure and a protocol of the types of questions that are being assessed. They enter their rating for each of those criterion, and then they are assessed the extent to which both of those raters agreed. If they have any disagreements, they then need to discuss that and come to a consensus, and then we come up with an overall rating for that particular resource. The types of criterion that we're looking at is the extent to which that resource is informed by scientific research. So is the information reliable? Is it based on research evidence? We also assess transparency. So is it clear who developed the resource and how the resource was developed? And then finally, usability. We want to know, is the information easy to understand and is it easy to use? And keeping in mind, that the primary audience for these resources would be those that are 50 plus. So again, keeping in mind what the needs are for that audience. And then we, once we've done that assessment, we give that web resource a rating out of 5. The overall rating is more heavily weighted for those web resources that use research evidence to inform what that product is saying. So a star rating of higher, 4 or a 5, would be a good quality, would be the highest rating that you can get, and the lower number of stars, the lower the quality. So just if you had come onto the site and you had done a search and found some web resources, just to show you a little bit here of what you would see. So first we see the title. So basically here, can Tamiflu prevent complications? We can see directly below that the star rating. So in this particular example, this web resource was given a rating of 4 out of 5, so meaning it's a fairly good resource. You then will see, you could share this. There's various ways for you to be able to post this to Facebook, to tweet about it, to email it to someone. So various ways to share information. You'll then see below that a summary of what is the overall key message and action of this web resource. You then, underneath that, will see what type of a resource it is. So in this particular instance, we see that it is an article and that it is something that you would read. We look for all types of information. So we can include surveys, checklists, podcasts, videos. So there's quite a range, and we just let you know what type of resource it is. We will then provide a link that will take you directly to that resource wherever it exists on the internet. And then if you want to see how we rated it according to the 3 criterion, so the evidence base, the transparency, and the usability, you can click on the view rating criterion. And then finally at the bottom, you see browse related topics. So behind the scenes, we've identified other relevant topics to this one, and if you were to click on those, you could actually go and see other web resources, other evidence that's relevant. So I'm just going to stop for a moment. I see that there is a question, so I'm going to go there, and just bear with me for a minute. With the BP slide. So I'm just going to read this out. Evidence summary looks too technical for an average senior citizen to understand. Yes, so, and also numbers may not be clinically significant. It will be useful to provide final conclusions after taking into account all clinical and statistical considerations. Very, very important. And so I will talk a moment. You will see that we are doing some additional things to make these evidence summaries even more user-friendly, and those will be blog posts, and I'll get to those in a moment, and you would see how we provide findings from these evidence summaries in a different way that will be more useful for citizens. And as well, keep in mind that we're continually working to improve the portal. So hearing your feedback on whether or not things are still too technical, those are very, very useful for us to hear. One of the, I guess you might call them, challenges with the portal is in trying to make evidence available for a wide variety of users, and this information may be really helpful for health professionals. It may be helpful for some citizens and may not be helpful for others. So please keep providing your feedback to us. There is a way to do that on the site through the Contact Us feed, and all of those will help us to continually improve the portal. So I'm just going to move on here to the blog posts. So blog posts, as I said, are commentaries on what the research means. There's a couple of different ways in which blog posts are being created. Currently, right now, we've been focusing a lot of effort on identifying priority topics to citizens that are 50 plus, identifying high quality, recently published systematic reviews, evaluating the effectiveness of different interventions related to those priority topics. Evidence summaries have been written on those, and then a professional writer is then using the evidence summaries and the systematic review and other evidence to write short blogs that are then posted on the site that are much more user-friendly, using lay terminology, writing a bit more from a story perspective of what those key messages are. And we feel that those will be particularly useful for citizens and caregivers in terms of putting into context what the evidence is saying. So just quickly here, what you would see if you come onto the site. And again, if you come onto the site and you're clicking to search the citizen interface of the portal, you would click on that. You can see blog posts, and you can search for blogs in different ways. It would be, we've listed down the side here categories, and you can click on those and see what types of blogs, which blogs exist under the different categories. And then we also provide visuals that describe the different blogs that are up there, and you can click on those as well. We see here one around fish oil supplements and what impact they may or may not have on high blood pressure. So just showing you here an example of part of a blog is what the research tells us. So this is just in very lay language, what the research is saying about the evidence. And then always at the bottom of the blogs will be highlighted in a table what the bottom line of the evidence is saying. Usually a statement about, what do we know about this issue and what are some things that we can do about that issue that can help us age optimally. And what we're also doing with the blogs is identifying whether or not there are other blogs or web resources or other material in the portal that are relevant to that particular blog, and providing links so that you could link right from the blog to that additional material. and just showing you here. So other related content, and these again are giving you examples of other exercise programs. There's one on hearing loss, as well as one on vitamin D. So just trying to make this as interactive and user-friendly and quick to find the kinds of information that different folks are looking for. So in addition to a portal whose primary target audience are citizens and informal caregivers, we also want this to be a useful site for professionals. And as I said, it brings together the best available evidence for clinicians, public health professionals, and policymakers. All of this evidence, we search the world, the published and unpublished domain to find evidence, and then to assess the quality of that evidence, and then to put it in a knowledge repository in such a way that it is as easy to find as possible. And hopefully by increasing the ease with which one can access that evidence and that it's been quality appraised, and to some extent evidence summaries and synopses of that provided, that it makes it easier to integrate that evidence into healthcare policy and practice. So just illustrating here that if you were to come on to the portal and identify yourself as a public health professional, that you can search by entering terms into the search box. You can also sign up to receive email alerts and you can see here if you were to press on Set Alerts, you can go there and identify areas of interest and how often you want to receive those alerts. You can go and search the site by using search terms that you're familiar with that you would like to use, or you could browse by just looking at a list of topics, and then you can also tell us more information and configure your profile in the way that it will be most useful for you. Just showing you here, this is a list of public health articles that have been most read by public health professionals in the past 30 days. One of the things just to note, you can come onto the site and without logging in, do some preliminary searching, but to really optimize the functionality of the portal, you need to log in, which means you need to have created a user profile. Anyway, this is just showing you here some of those, if you were in the logged in state, getting a sense of other colleagues in public health, what have they been accessing? And you can see here the types of topics, of reviews that they have been accessing, and also the quality of those reviews. With the email alerts, you can get lists on a weekly basis of anything new that's been added, or you can set the time frame for that. So you can get an email alert that will tell you about any new evidence summaries, any new web resources that have been added with their ratings, and any new blog posts that have been added. And then those links embedded in those emails will take you directly to that content on the site. And this helps keep you up to date with that new emerging research, and also up to date with information products that you may potentially have clients asking you about when you interact with them. So this is just an example of what the public health professional email alert looks like. So if you had signed up for it, you would receive this into your inbox, either weekly or monthly. And it will tell you, we'll see here, we have a Cochrane review, exercise for reducing fear of falling in older people living in the community. And we see that this is a very well done systematic review that comes from the Cochrane database. And then we also see the second one, which is on resistance training on blood pressure. So just an example of what that would look like. So I see that a question was asked, about what literacy level the portal aims for summaries and blogs. And there are two different answers there for those questions. So the blog posts really are aiming at, I don't know if I can really give you a grade level, but it is really trying to reach as many folks as possible and using as much lay language as we can. So making that really quite similar, that if you were reading a newspaper or a magazine, you know, that really is going out to the majority of folks. So I would think, you know, probably around a grade 8 level. The summaries are likely at a slightly higher level, which would probably be somewhere, I would think, between grade 9 to grade 12. So we're trying to continue to work on the accessibility of that evidence. It's also why we have created different ways in which folks can access that information to meet the varying literacy levels of those who may access the portal. We also are active on Twitter, and so if you were to sign up and follow us on Twitter at Mac-Aging News, the news Twitter feed, what this service does is we are searching major headlines of newspapers, internet stories, news stories that are occurring on TV. So we're looking for major health-related media, and then that is provided to each of us with the evidence resources, so each of the databases, and we look for high-quality, recent, relevant information that addresses those headlines, and then we tweet out within 24 hours what the relevant evidence says about that media headline. So as much as possible, we're trying to be really current and providing good quality evidence that addresses the different media headlines that are coming out on a regular basis. And, you know, we feel that this is an important activity to do, because many times those headlines may not necessarily be reflective of the best available evidence, or many times it might be quoting the results of a single study that just has been published. But when we actually look at what the evidence does, when you're looking at all of the evidence, so a synthesis of that, then it may be sometimes somewhat different from what that new emerging study might say. So in a way, and really just trying to provide reliable answers from questions that may emerge from headlines that come out in the media. So just a little bit about what it would look like. So it's a way to stay up to date, to follow us, and also in terms of subscribing. So just showing you here some of the tweets that have been happening quite recently. And these ones here look like they're around bone density and calcium D. So I just want to spend a little bit of time now showing you how to use and how to search in the Optimal Aging portal using both the browse function and the search function. And I'm going to use both of those because we do know from our users that people really have different needs and really want to look for information in different ways. And sometimes people just come onto the site, there isn't anything in particular that they're looking for, and so they can use a list of drop-down menu items to browse the search and see what's the site and see what's there. And then other times it may be that you're looking for something very specific. So maybe you've heard or received information about a diagnosis and you want to learn more about that, or someone you may be providing some care for is some issues that are evolving and you have some specific needs. So I'm just going to go through some examples. So here, if you were to come onto the, you've come onto the home page, and you can see where there's the little icon of the hand with the finger pointing up. So if you were to go click on from the home page, citizen, you see a drop-down list there that says browse topics, citizen search, evidence summaries, web resource ratings, and blogs. And so if we were to click on browse topics, this is the next page that will come up for you. And you will see here that we've divided the information into 3 major themes. You can search by health conditions, and there's a fairly lengthy list here. And you're not seeing all of them here in this screenshot. You can search by healthcare delivery. So for example, we see here community care, end-of-life care, hospital and institutional care, so different examples of the way in which healthcare is delivered. And then you can see on the third one on the far right, healthy aging practice. So a whole list here. We see exercise, fall and injury prevention, oral health, smoking, vaccinations, women's health. So you can click on any of these topics, and then you will go to, you will then be sent to information related to those. So you will see on this particular slide that on the far left, Alzheimer's and dementia is the topic that we are interested in searching right now. And so the person's come on, they highlighted that one, they click on that link, and this takes us back to Linda. If you remember, Linda was interested in wellness, exercise, vitamins, what to avoid. And so if we were going to search specifically on those topics, we might look up complementary and alternative medicine. And so if we've clicked on that, then what comes up for that here, we can see Alzheimer's disease, can ginkgo products help? And if you look at the icon on the far left, we see that this is a web resource. So this is a resource that we found on a site on the internet, and we've then done a rating of that. And the 5-star, if we look over on the right-hand side, the 5 stars, all in burgundy color, tells us that this is a high-quality review. It's received a 5-star out of 5. Underneath that, we can see an evidence summary that's related to Tai Chi and whether or not that can improve cognitive function in older adults with cognitive impairment. So now we know that this is a summary of a systematic review that has been written. We also see that this is a high-quality systematic review, and then we can also see where it was published. So we see on this screenshot here that we have some evidence summaries that come up and also some web resources, and you will see that they are in order of the highest quality first, and then they move down to the ones that have received fewer stars as you would go down the list. So that's one way we can search by browse topics and see what comes up, or then we can also enter in our own words and see what results then come up for that is both relevant for citizens, so web resource ratings and blog posts. You could also see what would come up for the health professionals as well coming out of the databases. Using your own words, your own search terms, will allow you to find more specific content and will allow you to access everything that exists in the portal with one click after you've put the terms in. So let's say, for example, we're on the home page, and right from the home page there's a box. We want to put into that search box the word vitamins. And now we see what comes up from the word vitamin. If I just direct your attention to the right-hand side, you will see down the box there that there are 13 evidence summaries, and we have a default on the portal that when you use this way to search for evidence, the first thing that you will find, what will come up in your results set, will be whatever evidence summaries exist on that particular topic. So we see here we have 13 evidence summaries. We're still looking down the box on the right-hand side. There are 57 web resource ratings. There are 5 blog posts. There are, from the clinician database, 753 items from the clinician database that have been tagged with the word vitamins. And we see from the for the public health professional, there would be 22 reviews that are relevant, and there is nothing in it for policymakers that is would have that word tagged as vitamin. While you're looking at that box on the right-hand side, you can click on any one of those, evidence summaries, web resources, blog posts. You could click on the public health professional, and then that will change your results set to whatever exists for that particular theme. So in this example here, though, the default took us directly to 10 of the 13 evidence summaries is what is going to come up on your screen. And we can see here that we have right off the top 2 5-star evidence summaries. So these are 2 evidence summaries that are based on the highest quality systematic reviews, and then we see they drop down to 4 stars of the next reviews after that. If we had clicked on the web resource ratings, which we see that there are 57 of. Again, if you looked on the left side of your screen now, you will see that the first 10 of the 57 web resources will come up. So we see the first one here around preventing osteoporosis. If you click on that title, that will take you directly to that web resource. But what you get in this box is the title. You get the the summary actionable message of what this web resource says, what its bottom line is. You see where it came from. So it came from Informed Health Online is the actual source. And we see that it is a 5-star web resource. So it's been given the highest rating it can achieve. And then we see below that the ginkgo product one again. And then we see the one below that, how to reduce cancer risk in here as well. And you could also set the default ratings if you wanted to see web resources first instead of evidence summaries. You could also customize your experience so that it would do that for you. And then finally, if we take a look at what exists for the 5 blog posts that are tagged with the word vitamins. So we see here the first one, Polypharmacy Part 1, Pitfalls of Multiple Medications, Taking Multiple Drugs and Risk of Interactions. And then this is, again, gives you the high summary actionable message of what this blog post is about. And in this particular instance, who the author or authors are of the blog post. And I didn't mention that before, but we actually have a few different ways in which the blog posts are being written. As I described earlier, we've been focusing most recently on a professional writer writing those blogs based on high quality systematic reviews. But we also have blogs where we've gone out to experts who are experts in a particular area and asked them to write a blog. And so you'll see a combination of both. If I draw your attention to the second and third blogs in the blog results here, you will see the Optimal Aging Portal blog team as the author, which means the professional writer has written the blog. It is then assessed by myself, who has expertise in assessing the quality of evidence and the interpretation of that evidence, and then is edited as well. If with this same search for vitamins, you were interested, you are a public health professional and you want to see what's relevant for public health professionals, if you were to click on that tab on the right-hand side, you'll now, all those results, those 22 systematic reviews will come up. You'll see here again what we see on the left-hand side, 10 of the 22 results for public health professionals are listed there. And we can see here several high-quality systematic reviews relevant to vitamins that exist in the database. And we can also, so if we were to click on the blue hyperlink, that would then take us directly to that page of that systematic review, and we can also see here where it's been published and in what year, and the quality rating. So let's look at another search. So if we're thinking about Janine's needs of caring for, let's say, a parent who's experienced a fall and wanting to prevent an additional fall, or wanting to understand the prognosis after a fall, or issues related to turning home, we could browse those topics. We can use the browse function, and we might use here fall and injury prevention. You can see that that's been highlighted. And if we were to click on that, what we see coming up here again are any evidence summaries, web resource ratings, and blog posts that exist. And all of this is the information that we're hoping is very relevant and useful for citizens and informal caregivers. So we will see here that in this list, we have a list of evidence summaries of all very high quality systematic reviews, and an evidence summary has been written for those. However, if you wanted to search a little bit more, you could come onto the home page, and under professionals, if you see the green arrow, so you would go along to the word professionals. When you click on that, you'll get a drop-down menu of clinicians, public health professional, or policymaker. You can click on the public health professional. You can then you'll come to a search box. If you were to put in the word fall, you can see a whole variety of words that could be used here in your search. So there's fall, fall prevention, fall related, fall risk. And so here we decided to use fall prevention. And then this tells us that we're seeing, if you look on the left-hand side, we're seeing 10 of 44 results for public health professionals, which would be systematic review. So we see the first one there, interventions for preventing falls in older people living in the community. We see that this is a Cochrane review published in 2012, and we see that it is a 5-star, so it is a high-quality systematic review. So you can see there you would see the first 10 of 44 systematic reviews. If I draw your attention now over to, again, the box on the right-hand side, we will see that in the portal, within the portal, fall prevention has 5 evidence summaries, 11 web resource ratings, 1 blog post, and then among the professional databases, there are 44 entries for clinicians, 44 entries that come from the clinician database, 44 from the public health professional, and then 15 for policymakers. And you can click on any one of these and see the results come up in the box to the left. One thing to also keep in mind is that, as I said earlier, the data is changing daily. So, you know, this screenshot may have been created a week or so ago when we were working on the PowerPoint for today. This could already be different. There may have been some web resources added, a new evidence summary added, new items added to the professional databases. So it is really important to come back and check often, as new material will be added regularly. So if we clicked on so I'm just going to take us back here for a moment. So if we decided that we really wanted to take a look at the interventions for preventing falls in older people living in the community, we click on that title, and then this is where we will go on the page within the portal. So we've now come to the page for that particular review. You will see the assessment of that in terms of how well done that review is. You can click to try to access the full text for that article, or sometimes you need to go to another database to get that, or if there's been a podcast or a plain language summary. So whatever else exists for that particular item, you can click on that to ask for it there. So if we decided to look at evidence summaries on fall prevention, so we've now would have clicked on the evidence summary button on the right-hand side, and the 5 evidence summaries are coming up that we could then access as well. And again, this is just showing us what this evidence summary looks like. We see here the review question, background, how the review was done, what the researchers found, and then an overall conclusion message of what the findings were. So in terms of a few tips around searching, it's always good to start your search with broad general terms. So for example, diabetes, exercise, depression. You saw here we use vitamins, fall prevention. If you end up with too many results, then you might want to refine your, maybe add some concepts together. So exercise and falls, or diabetes and heart disease. And this will help to narrow the list, as it will then, your search will then be looking for items that have both those concepts in it. And then definitely look for results across the different databases. So maybe you didn't find something in the health professional database, maybe there will be something in the clinician database that would be useful, or in the policymaker database that would be useful. So trying different strategies to help you with that. In terms of, as I was saying before, we really encourage you to register and to create a profile on the site, because this is the way in which you really optimize your experience in terms of the email alerts and in defining what types of information you're specifically interested in. It really will help refine that user experience to make this a site that's really useful for yourselves. So that's the end of the presentation in terms of the portal today. So just before I go to questions, I'm actually going to just ask another polling question and ask you, did you find today's webinar useful? And your responses are yes, somewhat, or no. So I'm just going to give you a moment to answer that. And I just have a couple of more questions that I'm going to ask you to comment on today. So we've just closed that poll. The third question is, do you plan on using the portal in the future? Yes, maybe, or no. And I think I saw briefly there, I believe there's some questions that have been posted. So I am going to come back and answer questions as soon as we are finished. We just have one more question after this one. And now I'm just moving on to the last question. Would you recommend the portal to your family and or friends? Yes, maybe, or no. And so we'll just have a moment while you finish that. And so I see here that there are a few questions that have come in. And so the one question I see here, when searching, can you check off all 3 databases, or do you have to search through them sequentially? So what basically happens is when you, and what I might do is actually just, I'm going to take us back in, so I can show you. Let's see here. I just want to get you a good example. So if we use this example here, should I go back one more? If we were to put into here, this is actually demonstrating here you've come in as a public health professional. All this does is that the first set of results that will come up for you on the left-hand side of the box, when I show that to you in a moment, will be for public health professionals. But actually, when you put the word fall prevention in here and then click the search button, and this next page that I put in front of you comes up, essentially you are searching at the same time everything that exists on the portal. We are just showing you the results separately from the clinician database, the public health professional, and the policymaker. So if you go over to the box on the right-hand side, that then lists evidence summaries, the web resource ratings, blog posts, and then all the results for professionals. The search has already happened. As soon as you clicked search after putting the word in, the search in all of the respective databases has happened simultaneously. It's just that we are segmenting out for you the results based on how you came onto the site. So if you came onto the site as a public health professional, we're showing you those results first. And then if you looked through these, or and then you said, well, I want to go take a look at the clinician one. If you click on the clinician in the right-hand box there, then you will get those 44 results that came in from the results of the search that you did. So you are immediately, you are simultaneously searching everything. We just segment out how you can see the results so that we don't put them all together. Let me just go back to the chat to see if there are other questions. So hopefully that is addressing your question. Just opening up the question and answer to see if there's anything else. So I'm not seeing any other questions coming in at the moment. So I might just keep us on the line. I don't know if I'm able to, in terms of the polling question that we asked around, would you recommend the portal to your family or friends? And it looks like the majority of you said yes, so that's wonderful to hear, and we hope that that will be a useful resource to you. I'll continue to comment on some next steps. So now that the portal is up and running, we are continuing to work very hard to populate it with content, as I've said, every day and every week and every month. If you have items that you think maybe would be useful for us to take a look at to add to the portal, we're very happy for you to make us aware of those, and so you can contact us through the portal and suggest items, websites, information to us, and we'll do our best to look at that as quickly as we can and determine whether or not it will be put on the site. We are also now moving into evaluating the portal. So we want to know, is the portal going to be a useful resource? Are people using it? Are they finding what they need? And ultimately, are they acting on the information that's in there? And acting can mean many things. First and foremost, we strongly recommend that anything folks read about on the portal, that they then speak to their healthcare professionals, caregivers, informal caregivers about that information first before acting on that. And so the next steps are really thinking about starting to conduct studies to evaluate the impact of the portal, and also in developing an advisory group of citizens and informal caregivers who can help inform these evaluation studies that we're going to be doing, as well as inform ways in which we can really engage citizens in helping to promote and provide content for the site. So we really want to get people as involved in helping us with the portal as much as possible. We do believe that many would like to play an active role in helping find the evidence, in helping sharing that information with others, in assessing the quality of that information. And we really want to learn from citizens how best to encourage people and really understand how people would like to participate. So we're starting with developing an advisory panel and seeking that type of information from those folks who would then be representing other seniors, citizens, networks that they belong to. And so if you yourselves are interested or know of someone who you think would be really interested in working with us and participating, please also send along that information. We'd be happy to hear that from you. So I'm just looking here for a little bit of additional comments that were made. Oops, it just disappeared. Just a moment here. There's a comment around, that we have a lot of Cochrane reviews, and they're not perfect. And definitely, the default on the portal is that it will show at the top the highest quality information, whether it's coming from each of the 3 databases or the evidence summaries or the web resource ratings. Cochrane reviews really are very high quality in terms of how they're done, which is why they would be receiving those ratings. But definitely understanding that there aren't Cochrane reviews for all the questions that are out there and issues that people have, and that also an understanding that Cochrane reviews, the ones that do exist, may not necessarily answer all of the questions that citizens and caregivers and patients have. And so that did come up today, that there is a fair amount of evidence there, but within the portal, there is a huge variety of information and evidence from many different sources, not just Cochrane reviews. In terms of other kinds of evidence and how we assess it, so as I've described, we created a new tool for assessing the web resources, and I'd be happy to, we would be happy to discuss that with you if you want to learn more about the specific criterion that we developed there around the web resources. In the some of the other databases, so for health systems evidence as well as MAC Plus, there are different types of study designs of evidence that have been included there. So if it's a randomized control trial, then accepted tools for assessing the quality of randomized control trials are used, or if it's a qualitative study that's been included, then what are acceptable criterion for assessing qualitative studies have been included. So there is a wide variety of information across the sites, across the databases in the portal, and we use what are currently existing tools to assess the quality of those. So I'm not actually seeing, I'm going to check one more time under the Q&A, and oh yeah, so I think we put that up. Could we see a copy of your first poll result? Read the number of older adults accessing info online. I don't know. I hear that you can't hear me, so I'm hoping that that you are still able to hear me. Can someone, can maybe one of the participants just write in if you are still hearing me? I can tell you that with the poll asking about planning on using, 97% indicated that they do plan on using the portal. Also, just to let you know that we will be posting the audio recording and the PowerPoint slides of today on the website, and those should be up in the next couple of days. So sorry for the silence there, but I understand you can hear me. So if there aren't any other questions, however, you can ask us. You know, we can answer any additional questions. If not, I'm not going to keep you on the call longer than we need to be. As I said, we will post the audio recording from today up on our website, and that'll be up in the next few days. And I'm not hearing any other, not seeing. So I have a question here, where and how to send names of individuals interested in the advisory group. So you can either send them directly to me, or you can go on to the Optimal Aging portal, and there's a Contact Us feature there, and you can send those through to us. And we will definitely be in touch with you as our work proceeds on that. We have a question that's come in that said, how do you keep up with funding? And so actually I should have mentioned at the very beginning that the McMaster Optimal Aging portal was made possible by donor funding that was made a gift to McMaster University by Suzanne Labarge to the McMaster Optimal Aging Initiative, which a significant portion of those funds went into creating the portal. So in all of the work that's gone into what we've been able to show you today, that was significantly supported by the funds from the McMaster Optimal Aging Initiative with funding from Suzanne Labarge. And now as we move forward with having the portal launched, now we're looking for additional longer-term funding through a variety of mechanisms in the hopes of maintaining and sustaining the portal into the future and continuing to increase its functionality and usability. Great question around how the portal is being shared with professional associations. And so we have widely distributed communications about the portal, both at the launch and then ongoing. So we've been doing webinars, we've been presenting at various conferences. There have been several articles in newspapers across the country that highlighted the portal. We are linked on the Public Health Agency of Canada's site and the senior site. And so we are continuing to look for partnerships around linking to other relevant sites. And next steps are we're working on developing really a business plan in terms of thinking about what other promotional activities do we need to be doing and how can we interact with other professional associations. The great question around the portal being available in French. Currently, we have a partnership that has just been signed that will result in the portal being translated into French and being fully searchable in French. And while it's not currently available in French, over the next few months, you will start to see that change, and more content will be translated into French. So we're very, very excited that we've been able to create the partnership that will allow that to happen. Okay, so I think I'm going to, I don't see any other questions that have come in, but I would like to thank all of you for joining us today. It's been our pleasure to bring this to you. I would like to thank Susanna Watson, who is the coordinator at Health Evidence, who is working on the Optimal Aging portal, as well as Heather Hudson, who's the manager of Health Evidence, who has also been very involved in the Optimal Aging portal and also providing support for the webinar today. I'd like to thank all of you for joining us. I hope it was helpful, and continue to share your ideas with us. We'd love to hear them, and hopefully the portal will be very useful to your work, as well as family and friends and colleagues in the coming days. So thanks very much for joining us, and that's all for today.